Okay, so we have a 4-year-old boy presenting with pneumonia. This is his fifth presentation in the last 3 months. He needed many courses of antibiotics from his doctor. He's got abdominal pain, and parents say that he has offensive smelling stool. He is up to date with his immunization. On examination, he is small for his age and pale looking. He's got finger clubbing and a high temperature with abnormal respiratory rate and heart rate. Oxygen saturation in air is 89%. There is reduced air entry and coarse crackles heard bilaterally over the chest, which indicates some bit of pleural effusion. Otherwise, the cardiovascular examination is normal. On the right, we see the blood test and chest x-ray. So I'll give you 5 seconds to pause the video and come up with your diagnosis. Okay, yeah, so the diagnosis is cystic fibrosis. Let's work this out together, shall we? So we have a boy, 4-year-old boy, who is suffering from recurrent chest infection. That is the key, recurrent chest infection. Why is it recurrent? Because this is his fifth presentation in such a narrow range of time, which is 3 months. In the past, he also needed many courses of antibiotics from his doctor. He's got abdominal pain and offensive smelling stool. This is really the key, offensive smelling stool. Also, another key feature is the finger clubbing. Okay. Now, going through the options we've got, is it pneumonia? Yes, it is actually pneumonia, but then we're obviously looking for the underlying causes, so we can rule that one out. Bronchiolitis, no, because bronchiolitis characteristically presents in patients under the age of 2, so we can rule that one out. Severe combined immunodeficiency, SCID, we can also easily rule that out by looking at the immunoglobulin profile of the patient, which are all within normal range, so we can easily rule that one out as well. Croup presents with a relentless cough, which are described as barking cough, so we can rule that one out as well. Looking at the chest x-ray, which is my favorite, to be honest, we do see some collapse of the left lower lobe, as you can see here. There's this silhouette sign, which kind of distorts the left border of the heart. As we do also see some consolidation here and here, because the costophrenic angle is kind of disappeared. And yeah, so let's learn more about cystic fibrosis. So it is combination of, as we said, clubbing, and again recurrent chest infection and malabsorption of especially fat and vitamins A, D, E, K. Why those vitamins in particular? Because those vitamins, ADEK, A, D, E, K, are fat soluble. So and also because of fat malabsorption, you will have bulky and offensive smelling stool. There is a meconium ileus. This is when the neonates don't pass the meconium, which is the first stool that they are supposed to pass once they're born. So if you see that a newborn is not passing that, then suspect cystic fibrosis or Hirschsprung's disease. There's also hemolysis, hepatitis, and prolonged jaundice, and rectal prolapse. Now, the pathology, cystic fibrosis, it is autosomal recessive due to defect in the CFTR gene, which basically stands for cystic fibrosis transmembrane conductance regulator. The gene codes for a protein that functions as a chloride channel and is regulated by cyclic AMP. Multiple organs are affected, such as the pancreas, so there is risk of diabetes, and obviously pancreas secretes insulin as well as other digestive enzymes, which means that if the pancreas is not working well, then the babies or the children fail to thrive, and their growth is said to be stunted. Intestine and the liver are also affected. Fertility in the later life is also affected due to absence of vas deferens for the very exact same reason. Now, how do we diagnose it? We do sweat tests. If the sweat tests show that the chloride levels are abnormally high, then that is kind of diagnostic. We also do genetic testing. In terms of management, it's a multidisciplinary team management. We do physiotherapy to remove the mucus plug. We also give mucolytic agents if needed. We do give prophylactic antibiotics. Gene therapy is underway. It hasn't really translated into clinical practice. So I hope that was useful.